Hi, this is Brian Kim. I'm going to share with you case number 40 in the Best Way to Do Cataract Surgery series. This is a dense cataract with a borderline pupil. I'm going to show you mechanical fracturing, double chop, cross chop to systematically disassemble this lens despite not being able to see the entire lens. And this is because I'm able to hook the lens with the chopper, get the chopper around the lens material, as well as the phaco tip, crushing the lens pieces. Other techniques require direct visualization. At least the surgeons feel more confident by doing sculpting, cracking, even chopping using horizontal or vertical chopping techniques. And for me, this is a huge liability, and this limits how you can do cataract surgery. In my opinion, the biggest liability is having to visualize your steps when you do cataract surgery. Whereas if you have the instruments within the capsular bag and be able to crush the lens material, regardless of visualization, to me this is a huge strength, and this is why I do think this is the best way to do cataract surgery. So I'm using my cotton tip to center the eye and then using the corneal marker to help me center and size the rhexis. You can see that the marker is about the same size as the pupil right now. I'm going to use the cotton tip to turn the eye and then make a flat approach with my paracentesis blade inferiorly and then superiorly. You can see the flat approach to the blade means that the blade is parallel to the iris plane, which creates a nice corneal shelf, which will allow me to make a nice self-sealing corneal incision. I'm injecting some intracameral lidocaine now. I'm injecting some intracameral epinephrine. You can see there was not much response, but hopefully it will stabilize the pupil in the process. This is some dispersive viscoelastic, and the dispersive viscoelastic, purely from mass effect from high intracameral pressure, will viscodilate that pupil. I'm using the cannula to hold the eye, and this is a triplanar corneal incision. I make a vertical groove, place the blade deep into the groove, tunnel through the cornea, and then rotate and then dimple down and enter the eye. That's a triplanar corneal incision. This is my puncture style Capsulorhexis. Be very careful going into the eye, and I'm going to puncture centrally, pulling down towards me. I'm going to grab the right side of the cut to create a flap, and I'm going around circumferentially. In this case, again, nice and easy because my pupil size is just a little bit bigger than my corneal mark size. I'm able to go around circumferentially, grabbing and re-grabbing. And that's the Capsulorhexis. I'm going to burp some viscoelastic to reduce that intracameral pressure. And then this is the Capsulorhexis hydrodissection technique. Place the cannula out to the equator, point the tip down. You get a nice fluid wave, decompress on the left side, and I'm spinning on the right side. I'm turning that tip downward to hook the lens slightly peripherally as I rotate the lens. Irrigating the surface of the cornea, and then I'm lifting the incision with the chopper and going in an atraumatic fashion to minimize Descemet's trauma. Start to remove the surface epinuclear material. I want to make sure I get underneath the epinuclear edge, underneath the anterior capsulorhexis edge with the chopper. Point the phaco tip vertically, subincisionally, bringing both instruments together, and that crushes the entire lens. That's the double chop. Place the chopper out to the right heminucleus, pulling the chopper centrally towards the phaco tip, crushing the right heminucleus. That's the cross chop maneuver. I place the chopper around that first quadrant, and I crush that lens piece and remove a little bit of that lens piece. Do the same maneuver over and over again. This is just a mechanical fracturing, disassembling the lens little by little using mechanical fracturing forces. I place the chopper out to the equator again and perform a cross chop maneuver on that second quadrant. Using vacuum, I pull that one piece up, crushing the lens piece, sandwiching it between the chopper and the phaco tip, and then emulsifying the lens piece using a little bit of ultrasonic energy and a lot of vacuum. I'm positioning that second quadrant in front of me. Again, because it's a small pupil, you want to really be very careful with your manipulation, making sure you don't try to take that phaco tip too much into the periphery, then you might snag the iris. I turn the second heminucleus in front of me, place the chopper out to the equator, pull the chopper centrally towards the phaco tip. I have the phaco tip deep, and I bisect that second heminucleus. I do the same maneuver around the third quadrant, crushing the lens piece. Now I'm performing mechanical fracturing techniques, crushing the lens pieces into smaller pieces, and then using high vacuum as well as bursts of ultrasonic energy to remove the lens pieces. You can see my phaco tip is essentially in the middle the entire time. I'm feeding the phaco tip with the chopper. The chopper gets around the lens pieces, crushes the lens piece, and I crush it against the phaco tip. And then once the pieces are smaller, I'm able to emulsify the lens pieces. But the chopper is really the instrument that's feeding the phaco tip. The phaco tip is essentially in the safe zone the entire time. Because this is a smaller pupil, you just have to be much more conscientious, making sure that phaco tip is in the middle so you don't accidentally grab the iris. And so you can see very systematically placing that chopper out despite poor visualization. I'm getting really very efficient and systematic and effective lens disassembly. Again, I'm using the chopper to pull the pieces around. I'm making sure I'm underneath the anterior capsule every single time when I do this. And I'm really trying to get around the endonucleus primarily, trying to spare the epinucleus. Keeping the epinucleus is so important because it does provide a little bit of buffer between you and the posterior capsule. And so placing the chopper around the lens piece, pulling it centrally, crushing it against the phaco tip, this is really just a very efficient way to do lens disassembly in the small pupil. You can see the epinucleus came out pretty nicely. And then I took the chopper out, pushing BSS into the eye, take the phaco tip out, and then the INA handpiece in. And this just provides some level of chamber stability. I'm starting the INA, starting subincisionally. You want to make sure you grab the edge of the anterior capsular portion of the cortex, and it peels off very cleanly. Whenever I have poor visualization of the periphery, I like to polish in the polish mode. This uses lower vacuum and aspiration because it is possible with the high vacuum to snag and suck and aspirate the anterior capsule. And then when you pull it, you can cause some zonular damage. And so you want to go in the polish mode, polish with confidence, making sure you remove any potential cortical material as well as cleaning up the undersurface of the anterior capsule of any lens epithelial cells. I'm pushing BSS into the subincisional capsular fornix with the cannula. Pulsing the BSS in this manner is a very efficient way of making sure there's no cortical material left subincisionally. You can see the bag was clean in this case. And then I'm injecting some cohesive viscoelastic to expand the capsular bag, as well as the sulcus here, so I can do a little bit of sweeping. And I'm going to sweep underneath the anterior capsule edge, first on the left side, and then I'm switching to the right side. And then using the sweep to hold the eye, I inject the single piece acrylic intraocular lens into the capsular bag. The leading edge goes into the bag. The trailing part stays out of the bag. I go in and then activate irrigation. I disengage the leading haptic and then trailing haptic off the optic, go underneath the optic, tilt it, and then rotate it 90 degrees. In this way, I'm confident that both haptics are within the bag, and I'm very efficiently and easily removing any viscoelastic from within the bag. I did a little polishing underneath the anterior capsule edge, and now I'm removing the viscoelastic in the anterior chamber. And then I'll hydrate my incisions after this. So this is such a powerful technique, and I've always had the attitude of you're only as good as your technique. And so if you have to do technique A, B, C, D, depending on big pupil, small pupil, soft lens, dense lens, that's a testament to the fact that your technique is limited. Because if you have to change techniques for every given surgical situation, that means your technique's not very strong. And that's the ultimate litmus test. If you have a technique that can handle big pupils, small pupils, soft cataracts, dense cataracts, that by itself tells you the strength of your technique. And I firmly believe double chop, cross chop, mechanical fracturing, pulling pieces out of the bag, using mechanical fracturing forces to crush the lens pieces into smaller pieces, is really a very powerful way to perform cataract surgery. So I hope this was helpful to you, and I thank you for your attention.